Today, Texas Attorney General Ken Paxton announced a major settlement with Texas Children's Hospital over gender-affirming care for minors.
Under the agreement, the Houston-based hospital group will pay back $10 million to the state and build what the AG's office calls the nation's first detransition clinic. And KVUE's Daniel Perot joins us now to explain what's in this settlement. Daniel?
The Attorney General's office has been investigating Texas children since 2023, claiming the hospital group illegally provided gender-affirming care to kids, then billed Texas Medicaid. While some are cheering the settlement as historic, others say they're appalled by the news of this clinic. In an unusual settlement with the state, Texas Children's has agreed to open a detransition clinic, a first-of-its-kind clinic in the United States to provide care for those who underwent gender transition procedures.
They have high rates of serious medical complications, and there are significant out-of-pocket costs for a lot of those things. So this is going to help address a lot of those needs.
The clinic will be funded by the hospital and be free of charge to the patients for the first 5 years. As part of their agreement with the state, Children's also agreed to pay $10 million, and they have to fire multiple physicians. AG Paxton called the settlement historic, saying it reflects an institutional and cultural shift away from radical gender ideology.
What we want to do is we want to offer real help, not false hope, for these people.
In a statement, a spokesperson for Texas Children's told KVUE it was a difficult decision to settle, saying they're protecting resources from costly litigation to focus on life-saving care. Advocates for the trans community say it's a blow to Texans.
For a hospital system to participate in this type of hateful rhetoric in this campaign and uplift this negative messaging that's not based in science, that is going to have health outcomes on trans people.
A 2025 study from UCLA estimated trans people make up less than 1% of the state's population. Andrea Segovia with the Transgender Education Network says most who detransition do so because of social pressures, not medical complications.
The amount of people who have quote unquote regret about transitioning is less than people who have regret about knee surgeries or getting a tattoo.
Several medical associations support gender transitioning care and say it's appropriate and medically necessary for children.
There is a body of research to back it up, and it is scientifically accurate, it is valid, and it is not experimental. It is healthcare that saves lives.
Texas Children says the new clinic will formalize the supportive multidisciplinary services they already deliver to patients.
I think it's a very practical solution that should be very effective.
Critics worry other states will follow Texas's lead in forcing more of these clinics to open.
We are prioritizing a type of healthcare that benefits a very narrow group of people and then rejecting healthcare that benefits a huge population of folks who live in Texas.
As part of this settlement, Texas Children's also agreed not to provide gender-affirming care to minors, implement ethics measures, and change its bylaws to automatically punish any doctor who violates Texas's prohibition on medical interventions to transition kids.